guys, it's Dr. Brandie with another episode of Pregnancy Pain Sucks. I am super excited about our talk today because I'm uniting physical therapy with chiropractic, which a lot of people think we don't get along. And today, Dr. Kristen and I are going to be talking about how the opposite is that. I brought Dr. Kristen on, and I'd like her to introduce herself so you guys can get to know her. She's in my town. So that's how we met. And I guess we have a mutual friend that plays tennis with me. So I've heard a lot about her, and I think you're going to be excited to hear what she has to say. So Dr. Kristen, tell everybody about yourself.
Yes, hi. Thank you so much for having me on the podcast. I'm super excited about today's topic and just showing the world how PT and chiropractor truly can work together to best support our patients. But my name is Kristen. I am a pelvic floor women's health physical therapist. I knew I wanted to do pelvic floor physical therapy when I was in graduate school. I had a 12-week rotation in pelvic health, and I just absolutely fell in love with the specialty and how holistic it is and how we can help so many people throughout the lifespan, not even just pregnancy, postpartum, but the entire lifespan, and both genders too. We'll get into this, but everyone has a pelvic floor and not just women. So grad school is kind of what introduced me into the specialty. I knew that's what I wanted to do. So then I went on to do a residency program through Good Shepherd Penn Partners here in Philadelphia to get my board certification in women's and pelvic health physical therapy. I also am a certified lymphedema therapist, so we'll get into that as well, but I also incorporate lymphatic drainage in with my patients as well. Pregnancy and postpartum is a big percentage of the clientele that I do treat, but it's not all that I treat. So I'm excited about today's topic and today's episode.
That's awesome, Dr. Kristen. And tell me a little bit about what drew you to it. Like, what do you love? What aspect of pelvic floor? Because people will be like, why do you like pelvic floor stuff? People ask me that because they call me the crotch fixer, and they're like, why do you like crotches? And it's not that. What is it for you that you really, it's not the actual act of what we do. What does it afford our patients, and what do we get to see in practice?
Yes. What I see day in and day out with my patients is the pelvic floor so often is the missing puzzle piece to all these different conditions that people have going on. So maybe they're seeing an orthopedist for their chronic hip and back pain. They're seeing a urogynecologist for their prolapse. They're seeing a GI for their IBS. They have no clue that all of these things are interrelated, and pelvic floor physical therapy really can be the answer and the treatment to help with all of these various conditions. As PTs, we do get more time with our patients. So a lot of times I'm spending an hour plus with my patients to really get the full story, put all the puzzle pieces together, and we can be the ones that can help people get the answers that truly are life-changing. And unfortunately, people go years and years of struggling with symptoms, and they think they're normal, they think that they can't be helped, and a lot of times that's not the case. So that's kind of what I saw through my shadowing and my internships as a student that made me be like, okay, this is what I want to do to help others.
Yeah, I think people don't realize like how life-changing it can be, and it's something that nobody talks about. For me, I always visit with my patients if I don't, because I was a paramedic before, so I did rotations. So if I have no idea what the patient's going to do, I ask to shadow them.
Mm-hmm.
And my first experience was in 2002 with Dr. Susan Kellogg, who's like a pioneer in the area. And she was so busy that like no one talks about this stuff. Do you know what I'm saying? Nobody talks about pelvic floor health. It's just started to come out. So do you see a lot of shame when you have patients, or they're sort of like they have no idea what to expect when they come into your office? Because your presence is at your office, and your presence is so calming.
Yeah.
So like, do you have a lot of people that are anxious when they come in because they have no idea what you're gonna look at, what you're gonna do, all of that?
Yeah, I would say it's really hit or miss, and it also really depends why the patient is coming in. And I feel like I'm pretty good at picking up on that right away because it is important to meet the patient where they're at. If they're super anxious, I'm not going to be at level 10 out of 10 super excited like, "Yay, this is pelvic floor therapy. I'm so excited you're here." Whereas if I'm seeing someone who I can tell they're really excited, maybe they're not having a ton of symptoms. Where this comes up a lot is individuals who are pregnant, and maybe they're more so just coming in proactively to learn about their pelvic floors, learn how to have the best pregnancy possible, the best birth outcomes, but they're doing pretty good physically. Those patients, not as anxious, more so just excited to learn, and those are always super fun sessions. But sometimes we are seeing people when they're at really like their lowest point. A lot of pelvic floor dysfunction, unfortunately, arises as a result of trauma. So a lot of times people are coming in, they are very anxious, they're very scared. Maybe they've read online that pelvic floor PT is quite invasive. It a lot of times does involve internal vaginal assessments or rectal assessments to get the answers that we need. So definitely do get a good number of patients who come in anxious, unsure of what to expect. But I do think it's important, again, to meet the patient where they're at. If they're not comfortable doing a physical assessment day one, we can spend the whole hour talking, educating. There's so much we can do to still help without like re-traumatizing them, right? So meeting the patient where they're at and taking it at their own pace, because a lot of times after you build that relationship, see them a couple of times, that anxiety slowly fades, and we can kind of progress our plan of care accordingly with that.
Yeah, I find that with chiropractic, and you and I were talking about that. See, I'm like that with the neck, or pretty much anything in my office, and you're the same way. That if somebody really isn't comfortable doing that, if you take that off the table, a lot of times that does help. Where they're like, "You're not just trying to push this," or "I'm not a cookie cutter patient for me." Talk to me a little bit. We're going to switch gears
Yeah.
about chiropractors and physical therapists.
Mm-hmm.
Uh, for me, my mentality has always been, I've had physical therapists come up and yell at me before, or I used to be in the gym,
Mm-hmm.
and it was a very adversarial relationship. And for me, I would always say to them, there's 50,000 of us and 50,000 of you guys. Like,
Mm-hmm.
there's enough for everybody. And I never thought that there's any type of competition. I think that you guys are so valuable when it's done right. And you probably feel the same way about what I do when it's done right. And so
Mm-hmm.
talk to me a little bit about your feelings about chiropractic and how it fits in with physical therapy.
Yes, and this is getting into like the meat of episode. So I'm really excited
I
to.
started drinking I admitted on one of my podcasts that I love Diet Coke. So my intern got me this Diet Coke water thing. So I'm trying. It's like a trick in my head. So I'm going to take
Oh,
a sip of that
awesome.
wine.
Yes, I love it. It really does look like a glass of
It
Coca-Cola.
does. Like it tricks me a little bit from not drinking so many Diet Cokes today. I'm trying to break my addiction in 2026.
Yes. So I love working hand in hand with chiropractors. I think especially when it comes to pregnancy, postpartum, the patients who are just in such debilitating back pain, hip pain, SI pain, pubic symphysis pain, we really have such a great opportunity to work together. Chiropractor to do more manual hands-on techniques to kind of help get the pelvis moving in a little bit better position, especially as we're talking about preparing for labor and delivery. We don't want a mom going into delivery in immense pain, scared to move, unable to move, because that's going to affect their birth outcomes. So chiropractors, I love working with them to kind of do more of like the manual hands-on pain reduction techniques. And then we can kind of intervene alongside with that to work on more so the muscular component, the strength, the stability, the coordination of the muscles, kind of for the long term to help maintain the alignments, the adjustments that the chiropractors are making.
Yeah, I think it's like a perfect relationship. I wish we got along more. And everybody that I work with, I do. And I think it's about a lot of our education is the same, but the
Mm-hmm.
emphasis on it is not so much. Like we got rehab in school, but that was not the main crux. Just like with physical therapists, unless you've done advanced training, your mobilization or adjustments might
Mm-hmm.
not be strong. So I've sort of looked at it as like a personal thing of like, what's your superpower and how can you help
Mm-hmm.
patient. So a lot of times I'll take them at first to get them moving, get them like cleaned out with their knots. And then while we're doing that, after about 4 visits, I'm handing them over to somebody like you so we can co-manage because I need to step out because once we get it cleaned out, we got the spine moving. Now we need to strengthen on top of good. That's the biggest
Mm-hmm.
flaw I think I see in physical therapy. Not saying that you do this at all, but
Yeah.
where traditional physical therapists just exercise over a problem. Like they start doing
Mm-hmm.
strengthening over trash, essentially. I know that's not your philosophy.
Mm-hmm.
Talk to me a little bit about that with your philosophy of this. Maybe the same. I think we're the same way of cleaning things out, making them
Mm-hmm.
move, and then strengthen on top of good form. Talk to me about
Yes. Yes. So when it comes to pelvic floor physical therapy, although that is my specialty, that's not the only thing that I'm assessing and looking at with my patients, which I do think that is a common misconception. people think pelvic floor physical therapists just lay patients down on the table, assess their pelvic floor, say whether it's tense or weak or we need to strengthen versus stretch. And that is just like scratching the surface of what we do. And a lot of times that's not even the top priority for me. So, day one with the patient, take their whole history, going through everything from bowel, bladder, sexual function symptoms, even if they're not reporting that, even if someone's coming in saying, I have back pain during pregnancy, I'm still going through my whole history because if one system isn't functioning well, say bowel movements. If a patient is constipated, that's going to put more strain on the whole system, the pelvic floor muscles, the hip, the spine. Is really important to address that, or else the tension that likely is contributing to the back pain isn't going to get better. So diving into the history is so, so important and can give you so many more answers as to where to go with the more so education piece of the treatment, because that is such a big part of what we do as pelvic floor physical therapists. After that, I kind of go into more of a functional movement screen. So, just what it sounds like. How is the patient moving functionally? Can they walk up and down the hallway? What does that look like? How's their posture? How's their breathing mechanics? Is their pelvis really tilted anteriorly, posteriorly? How's their single leg stability, their squat, their step up, their rotation? Are they showing signs of hypermobility on their movement assessment? Because we know in the research, hypermobility, pelvic floor disorders, very high prevalence of those going hand in hand. So just from that quick little movement screen can give us a ton of information as to what may be driving the patient's pelvic floor dysfunction. Again, pelvic floor orthopedics are not two separate specialties. If you're a pelvic floor physical therapist, you're also an orthopedic physical therapist. So doing that screen and then finishing with the pelvic floor assessment to kind of tie all the pieces together. It's not just is their pelvic floor tense, it's more so why is their pelvic floor tense? Are we finding right-sided pelvic floor tension? Is that because their single leg stability on the right is horrible? Is that because their right hip is oriented in a way that is putting that side at a disadvantage? So really just putting all the pieces of the puzzle together, I think, is so important, and zooming out from just the pelvis, both physically and also holistically.
Yeah, I love that. I think,
Thank
what
you.
are some things that you see that like people are not, what's the biggest thing where like, for me, unfortunately, the most common side effect from chiropractic organically, I'm not a chiropractor who does like, if I adjust you, your bowels will get better or whatever. But that's like the number one thing with adjusting the lower back, that my patients like don't put two and two together. They actually go to the bathroom better
Mhm.
because they're nervous. That's like the farthest I go on the, like, because I'm the most medical
Yeah.
chiropractor you'll meet. But like, what's something from the pelvic floor that might be causing a symptom in a pregnant woman or a man or somebody where they're just like, oh, I had no idea this and this had to do with each other. Talk to me about that, because you talked to me about IBS and all of that kind of stuff. What's the number one thing that somebody's like, holy heck, I didn't know those two things were related?
Yes. So that's a really good
There's
question.
a
So
lot. There's a couple that you were talking about, and
yeah,
I know of a couple too. Yeah.
yes. So I guess something that comes to mind that I see a lot is people with recurring urinary tract infections. I see so many people, usually women, who have a history of recurring urinary tract infections. Maybe some of them are actually diagnosed on a urinalysis, or maybe they're saying it feels like I have them, but every time I test, they're not finding anything. So I go on the antibiotics anyways, but maybe it helps a little bit, but then it seems to always come back. Overactive pelvic floor muscles present very, very similarly to symptoms of a urinary tract infection. So that's a conversation I'm having a lot with my patients, educating them on what I just said, that the symptoms are very similar. And by addressing overactive pelvic floor muscles may help with their urinary symptoms. Other signs that you could have overactivity in your pelvic floor muscles is things like I mentioned earlier, chronic back pain, chronic hip pain, tailbone pain, constipation, urinary urgency, urinary frequency, trouble emptying your bladder, having to strain with bowel movements, history of constipation, any sort of pain with insertion, whether that be tampons, medical exams, pain with sex. Those are all kind of things that fall in the realm of having an overactive pelvic floor or having more tension within your pelvic floor, that people are not tying these symptoms together and thinking that they're separate issues.
Mhm. I think both of us don't really get into woo that much. That we have that in common. But like, talk to me about like I find it interesting with my patients with pelvic floor, there's a huge emotional component, just sort of like fibromyalgia. It's not the cause, because you
Yeah.
don't know if it goes backwards where they didn't feel good and now they don't feel, especially with prolapse and that sort of thing. It sort of messes with your identity and how you
Hmm.
feel about yourself. Talk to me about stress or breath work, or
Right.
all of that is huge. It sounds woo,
Mhm.
but if you're not breathing correctly and all that stuff, talk to me about breath work or emotions as it relates to the pelvic floor in an evidence-based way.
Yeah, so let's start with yes, this is such a great question, and
Yeah,
it's so important because if you phrase it in the wrong way, a patient could take it as the woo and take it as, oh, you're just telling me to breathe, and that is all in my head. So it's so important that when we're explaining this
that's
to
why I'm phrasing
patients,
it like that, because I don't want them to think we're woo, but there's a
yes,
huge tie-in with this.
yes, we want to explain it in a way that it's like, no, this is evidence-based. This is
Right.
actually
Yep.
going to help you. So I guess the first thing I want to start with is diaphragmatic breathing. So your diaphragm is your primary breathing muscle located right underneath your rib cage. And this is really how we connect with the pelvic floor. When we take a diaphragmatic inhale, meaning we're inhaling, our chest isn't moving at all, but our ribs are expanding out to the side, 360 degrees first, then your belly rises, then your pelvic floor is forced to lengthen from a pressure management perspective. If your diaphragm muscle, your ribs are expanding, your belly's rising, the pelvic floor has to drop down in order for that to happen. It can't stay tense and way up in the ceiling. I talk about this a lot with my patients, the concept of ground level, basement, ceiling. If you're taking a diaphragmatic breath into your ribs, into your belly, your muscles can't be anywhere but in the basement. They have to drop down. So if someone does have overactivity in their pelvic floor, we start day one, diaphragmatic breathing, teaching them to breathe into their pelvic floor to lengthen it and almost stretch it downwards as a very simple way to start working on releasing tension at home just with your breathing. Maybe we pair that with a daily 5-10 minute stretch and mobility routine to also address any restrictions in their hips, in their hamstrings, in their back. But they're not just holding a child's pose for a minute, they're breathing into their pelvic floor for that whole minute to get that added benefit of we're lengthening the pelvic floor while we're also stretching these other muscles. When we talk about the emotional piece of it, the pelvic floor muscles are very closely linked to our fight or flight nervous system, and this has been shown time and time again in the research. There's actually been studies where they put electrodes on the pelvic floor and also on your jaw, your neck, your shoulders, and they found that when people are watching a scary movie, I think they did one watching the movie Jaws with the shark scene, they show that when they're anticipating the shark attack, your pelvic floor muscles clench, and then everything up here is also clenching. So that's happening all throughout our day. We see something horrible on our phone, another horrible news story, life stressors just day to day, picking up throughout your workday, running around busy. So many of us are in this fight or flight mode all the time. And that is stored as stress, tension within our pelvic floor. So, something I always talk about with people is just, first of all, realizing that that's happening. So, just body scanning throughout your day, realizing that you're clenching. If you're clenching up here, you're clenching down in the pelvis. So, taking those diaphragmatic inhales into your pelvis throughout the day, just as a both nervous system reset and a pelvic floor reset. When people have a history of trauma, that adds a whole another kind of layer on top of things, especially when it comes to pelvic floor physical therapy, which is a very sensitive, like vulnerable therapy where you are sharing a lot of information. It is a very like intimate, personal, close sort of setting. So always just checking in with the patients. I'm always like getting their consent, obviously, but like even more so, like if at any time you're uncomfortable, you don't want to proceed, if anything's triggering at all, please let me know. We will stop, because the goal is not to, again, further like kind of have them live their trauma, but doing this therapy to almost kind of help heal their trauma, because trauma really is stored within the pelvis. And if we're not releasing that, then that can be something that causes pelvic floor dysfunction to kind of keep going on. We work very closely with our mental health counselors, our sex therapists, to make sure we're also addressing the psychosocial components as well. But that really is such a big piece of it. And so many individuals with mental health struggles also have pelvic floor dysfunction as a result of the fight or flight nervous system sort of response.
Yeah, I think people don't understand that. Like they say that 80% of what walks into a chiropractic office is stress. And
Mm-hmm.
as much as I'm not a traditional chiropractor talking about nerve interference and all that stuff, like a nervous breakdown is a mental event where there's too much input or too much activity in your nerves where you feel like you're fried. Do you know what I'm saying? And for me, the pelvic floor is huge, especially in pregnancy, because it's your identity, it's how you feel. But the other one that goes around is this stuff, this
Mhm,
upper back, neck, like ribs, ties into
mhm,
what you're saying with breathing. Like breathing for me, when I had to heal from my extruded disc at C8, like I lost all use of my arm, breathing was one of the things I had to add on after chiropractic care, physical therapy, epidurals, just because the reason I got into that where my breaker blew, so to speak, in my spine, like it was a
mhm,
physical event, but it was the stress of my scalenes, my neck, the
mhm.
jaw. Like I carried so much tension for me. That was one of the things I had to, because it kept happening. So
Yeah.
look at
Mhm,
another way of healing yourself to calm your nervous system down without sending woo, but also
mhm.
your structural patterns. So what's a good sign if somebody's in a traditional physical therapy program? Do you work with a lot of physical therapists where they're ethical and say, like me, myself, where you're like, hey, they're not getting better, they're not getting the gains that we,
Mhm.
maybe this is something to consider. Talk to me about that. If somebody's in physical therapy, where would they sort of know with how many weeks? I mean, it depends on the condition, but what might be like, well, maybe I should go see Dr. Kristen at her office to get an evaluation to see that something else might be going on.
Yeah. I feel like this is very depending on the physical therapist that you're working with or talking to, but I guess I'll just kind of speak for myself. We know that true muscle change takes 6 to 8 weeks. So if a patient is 0% better by 6 to 8 weeks, you for sure should be looking into alternative referrals and routes.
Yep.
I think where it becomes tricky is a lot of, especially physical therapists who are not pelvic floor physical therapists, they might not know the questions to ask, the puzzle pieces to put together to think, oh, I think pelvic floor PT could be helpful.
Like
Before I
chiropractors too. They don't. The chiropractors don't think that way either, and that's a
yeah.
huge piece of if your patient's not. I think what you said is
Mhm,
so important to be ethical in our professions.
mhm,
Is both of us. It's not. It's knowing what's ours and what's maybe not ours, but needs to be shared with someone else, and that sharing is how you get trust with your patients.
yeah.
Able
Mhm,
to be like, I'm not the end all be all in this care. It's emotional,
yeah.
it's
Mhm,
structural. So I really love that you say that, because I'm, my
mhm,
thing is like weight loss. Like if I've dieted for a week and I see no change, there's something wrong. I need to lose some weight. You don't have to be like skinny or whatever, but like I need to see that we're on the right track, because
yeah.
otherwise both of us sort of throw whatever we can at the
Mhm,
patient. So we're
yeah.
missing something.
Yeah. And there's really no room for competition. Like we're all in it because we
No,
want
there's no
the
competition. Yeah.
the best outcome for our patients. And like you're saying, if I refer a patient to you and that gets them from 50% better to 75% better, that's a win for all of us truly. And it does build more trust with my relationship with the patient as well. So constantly referring out to my practitioner friends in the area, it's so important.
Yeah, it's not weakness. I think for younger, I mean, you're a younger practitioner, but I love that you say it, because it's not weakness to let a patient go, because then they'll trust you instead of, I
Mhm,
think both of us are into empowering
mhm,
patients instead of making them dependent. The end game is to get them better, get them the results that they need, and
yeah,
teach them how to be more present and aware in their body. So I think that
yeah.
that's super, super important. Talk to me a little bit about internal work while
Mhm,
somebody's pregnant. What are your thoughts, or what was your training on that? Because there's a lot of
yeah,
like as a chiropractor, what I studied with Dr. Susan Kellogg. She's like, you can do this, but in the state of Pennsylvania, chiropractors are not allowed to enter a patient's body
yeah.
at all.
Mhm.
So, like in other states, we can reset a coccyx and do pap smears, which I have no
Oh,
desire to do.
wow.
Thank God we can't do that in the
I didn't know
state.
that.
But like, talk to me about your philosophy of pregnancy versus not being pregnant, of internal work.
Yes. So during pregnancy, I absolutely think internal work should be included unless there's a contraindication. So there are some times where if a patient is on pelvic rest for any reason, meaning they're being told nothing can enter the vaginal opening, no sexual activity, no internal medical exams, usually that's a result of something is being monitored with the baby. They just want to be extra, extra precautious with things entering vaginally. That's not very common though. So for most people, they're not on pelvic rest. So vaginal exam, totally safe to do during pregnancy. It's not advised to do in the first trimester, and that's coming from the APTA, the American Physical Therapy Association Academy of Pelvic Health. In their kind of handbook, they say we don't advise doing an internal assessment in the first trimester. That's not because it's going to hurt the baby. It's more so out of a abundance of precaution, because we know that a large percentage of miscarriages do happen in the first trimester. So we don't want to take the risk and potentially be associated with, oh, I saw my pelvic floor therapist on Friday and Saturday this happened. So holding off till the second trimester. Me personally, I like my patients to, on their referral from their doctor for pelvic floor therapy, I like them to include okay for vaginal assessment, just so I know they're 100% on board with this is what we're doing, this is why we're doing it. Because unless you're assessing the muscles internally, you're not getting the full picture of one, muscle tension, two, their strength endurance, and also three, their pushing ability for delivery. There's also a lot we can do internally in terms of mobilization, soft tissue release, perineal massaging as we get closer to delivery to help reduce tearing and improve birth outcomes. So there's no reason to hold off as long as medically everything is looking good with the mom and also with the baby.
Yeah, so I teach on the outside. So what I learned from Dr. Kellogg was to stay on the outside. So I do pubic work strictly on the outside. And then if somebody's not getting better from that, and you and I had talked about a little bit, and you're the sort of like the classic patient, you're like, why? But being in practice 24 years, the highest propensity of having somebody having pelvic floor issues on a first pregnancy is gymnast, dancer, horseback rider. So if you have a teenage daughter, right, who is partaking in these high pelvic floor activities that they don't even know that they're stretching their pelvic floor. We talk about that, like the plastic fruit bags or the grocery bags we can't get in this area anymore, that you stretch it and it can't go back. What are some ways? First of all, talk a little bit about that, because you were a high level gymnast, and we both from Downingtown. Shout out to Downingtown. But like, talk to me about ways women or girls. Is there any way to like preserve? I know that you can't affect ligaments. But what are some good activities somebody could not annihilate their pelvic floor as a teenager, which would lead to having extreme pubic issues on your first or second baby?
Yeah, so this is something that Brandie and I talked about off camera when we met for the first time in person last week. So I was a high level gymnast. I find a lot of times patients that I'm seeing, especially, like she said, first time moms during pregnancy, a lot of the patients that are coming into my office with this pelvic girdle pain, SI pain, back pain, coincidentally, or maybe not coincidentally, tend to be histories of gymnasts, cheerleaders, dancing. And I think that's for a couple of reasons. I think one, the individuals who gravitate towards these sports tend to naturally be on the hypermobile spectrum, meaning the joints, the tissues in their body move a little bit more than, say, the normal person. What this means during pregnancy is you're pregnant, hormonally, things are moving even more than the normal person. That causes a lot of irritation, especially within the pelvic girdle. Also, when you think about those sports, gymnastics, cheerleading, dance, like Brandie said, they do kind of focus a lot on hyperextension, stretching maybe past the end range of a split of your pelvis, of your hips. So there are some changes that do happen. Like me personally, my hips are very, very hypermobile. Would they have been this way if I didn't do gymnastics? It's kind of hard to say. But now in my adult life, what is really important is whether it was a hypermobile spectrum disorder issue or you overstretched your pelvis as a teenager issue, you really want to focus on the stability, because if you don't have the strength and the stability within the muscle groups surrounding the pelvis, which those are your back stabilizers, your deep core muscles, your transverse abdominis, your hamstrings, your hip flexors, your glutes, your quads, literally all those muscles that surround and attach up onto the pelvis, if those don't have the strength and stability to support your pelvis, the first thing that's going to happen is those pelvic floor muscles are going to say, oh, let's tense up and let's hold on and let's strain to support everything. And that's what I see a lot of times with my patients, and that is why they're having this pain during pregnancy. There's so much tension. Those pelvic floor muscles are just trying to hold on for dear life. So a lot of what we do is working on getting stability in all these helper muscles so the pelvic floor can then relax and not have to strain and not have to work quite as hard.
Yeah, I say about the pubic stuff. Like to me, pubic work is just like a shin splint, where your pubis is actually like not physically saying, "Oh my God," from the second baby, like it's a little bit lower, but it's just like under so much stress that it reacts, and that's why you have that exuberant response in the pelvis, just like a shin splint. Same
Mm-hmm.
pain, same bruising. So that's how I teach my patients with that, and it's just it's interesting to work with that population because it could be life changing for them to be able to put their pants on. It's
Yeah.
such an emotional thing because you can't talk to anybody. A lot of women do not say like, "Hey, my groin hurts," or like, "I
Mm-hmm.
have a lot of pain down there." And
Mm-hmm.
people, I find when I post about it online, a lot of men, yay men, make fun of that, and it's debilitating. So, talk
Yeah.
to me about how you can turn that around for a woman and really give her her ability to take care of her other kids, and feel good about herself. Like it ties into your sexuality, it ties into how you feel about yourself, your ability to do
Mm-hmm.
things. Talk to me about that.
Yeah, I think this goes for both within pregnancy
And men,
and
and
also
men
after.
too. Probably men it affects them too, because I don't do a lot of men's groins.
Yes,
But
and also men too. I think
yeah,
just one, validating them, like you're saying, giving them an opportunity to share their story and their symptoms, you hearing them, listening, being a very attentive listener. I think that's so important. And then kind of explaining to them why this is happening. So again, putting those puzzle pieces together. Oh, you were a gymnast, you likely had this going on, and that's why this happened, and this happened, and this happened, and that's how we got where we are today. And I always say this is not to overwhelm you or kind of scare you. This is to give you a roadmap as to how we're going to get you in a better off spot. Because a lot of times people come in and they're like, all of a sudden I have this horrible pubic pain. And it's like, it's not all of a sudden, it's the straw on the camel's back. Your body was dealing with this for so long. And now this is just how it's presenting. But the good news is there's so much we can do to help support you and get you relief. There's ways to modify, there's support belts that can help relatively quickly, get you in a better spot. And then for the long term, we're really going to address again that root cause of the dysfunction by working together with other members of the healthcare team to kind of get them back to where they want to be.
yeah, it's very validating. I think it's validating, and it's for me, especially with pelvic floor stuff, it's so scary because it's so painful that when they understand why it's happening and not just this random pain is hitting them, it makes it less scary and that they
Yeah.
have control over it. So, just to sum up, where can people find you in this area? I love your practice. Your colleague that I've worked with, I've been in practice for 24 years, and you guys just have such a great reputation.
Thank you.
Tell people where to find you, because I trust you implicitly with my patients, and
Thank
I
you.
really value the relationship, especially from since you've joined the practice. Like you're such a light on social media. Where do people find you to help with their stuff?
Yes, so I work for the pelvic room. I'm mainly in our King of Prussia office, which is located within King of Prussia Doulas. And then I also treat in our Exton office once a week, which is located within the Healing Sanctuary in the Exton Commons. And the other owner of the pelvic room, my one and only coworker, she's the best,
Mhm.
Teresa Fiola, she also treats in the Exton office as well.
Yeah, that's great. But where can they find you on social media?
Oh, social media. Yes. Sorry. So, my Instagram is at dr.kristen pelvic PT, and I'm also on TikTok, and it's my first name, Kristen, my maiden name, Nicolosi, one word, Kristen Nicolosi.
Thank you so much. I love your social media. Like it's very down to earth, and I love it. So, what's your last parting thing that you want to tell pregnant women out there? Somebody who's really struggling right now. What would you like to tell her?
I would say it's never too late to seek out help. I feel like a lot of people think, oh, like this has been going on for my whole pregnancy. I'll just wait till after the delivery to come see a pelvic floor therapist. I only have a couple weeks to go, but just knowing that we can help you at any stage that you're in, even if you're about to deliver in 2 weeks, we can still do some things that are going to make your postpartum outcome better and also help you feel better and get you in a better spot going into the delivery. So just knowing that it does get better, there are tools and there are teams out there that have the skill set to help you, like Brandie and I. So don't be afraid to seek help. And also, pelvic floor is something that isn't talked about much. So don't feel like you're alone. There are so many people suffering in silence. So again, just not feeling like you're alone.
I love that. I just love how you just like you make like it's very important when I teach other chiropractors to have sort of that presence where you're just non-judgmental, curious, and I think that and educating in a calm way And I just really highly would recommend you guys check her out because she just like impressed me so much. So I pulled her onto my podcast. But this has been Dr. Brandie for Pregnancy Pain Sucks. You can find me locally and Paoli at the Bloom Sanctuary. And Dr. Kristen is around the corner in King of Prussia and KOP doulas. And I thank you. I hope you learned a lot of how chiropractors and physical therapists can work together and have a very successful outcome for you as part of your birth team. So thank you very much and tune in next time. And thank you for listening.
Thank you.